The battle against antibiotic resistance is a critical issue, and recent developments in the UK have raised concerns. Despite a slight decrease in overall antibiotic use, the UK Health Security Agency, UKHSA, has warned of a sharp rise in antibiotic-resistant infections and related deaths in England. This alarming trend highlights a growing global threat that could impact routine medical procedures and our ability to treat common infections. The UKHSA's latest report, the English Surveillance Program for Antimicrobial Utilization and Resistance, (ESPOR), reveals a disturbing increase in resistant bacteremia cases and a widening inequality gap between the most and least deprived communities. In 2024, there were 20,484 cases of resistant bacteremia, a 9.3% rise from the previous year. Deaths linked to these infections also increased by a staggering 16.6%. But here's where it gets controversial. The report suggests that private prescribing practices may be contributing to this overall rise. While antibiotic use in NHS primary care saw a slight decline, private dispensing in community pharmacies more than doubled between 2019 and 2024. This led to a 10.7% increase in primary care antibiotic use when considering both NHS and private prescriptions. The findings come at a critical time, 1 year into the government's 5-year National Action Plan on Antimicrobial Resistance, AMR. The plan aims to address AMR by 2040, but the latest report indicates a difficult start. Experts warn that without effective action, routine procedures could become unsafe, and common infections may become untreatable. Inequalities are also deepening, with a growing gap in resistant bacteremia cases between the most and least deprived communities. This inequality gap has widened from 29% in 2019 to 47% in 2024, a deeply concerning trend. Dr. Katrin Moore, a reader and associate professor in global health and infectious diseases, expressed her concern over the doubling of private dispensing in just 1 year. She emphasized that AMR is an urgent healthcare crisis, not just in low- and middle-income countries but right here in the UK. Dr. Jonathan Cox, a senior lecturer in microbiology, agreed that rising private prescriptions are a significant concern, urging colleagues in private practices to consider the long-term implications of inappropriate prescribing. So what can be done? Experts call for urgent investment in research and development of novel and alternative antimicrobials, as well as streamlining the regulatory process to bring these innovations to market. The role of pharmacists in antimicrobial stewardship is also highlighted, with expectations that they will play a growing role in managing common conditions and reducing system pressures. This crisis demands our attention and action. It's time to challenge decision-makers and address the growing health inequalities in the UK. The future of our healthcare system depends on it.